The U.S. has officially surpassed the awful milestone of 1 million reported deaths from COVID. This is a number that I think very few of us thought would ever come to pass when the pandemic started to break in February of 2020. In fact, back then, I think we thought a concerted response would mean that the number would be a tenth of that or even less. Now, the true number of deaths in the U.S. from COVID is even larger. We think, based on looking at excess deaths, it's probably closer to 1.3 million deaths that have already occurred. But by either metric, it's a staggering number. COVID has had a terrible toll, not just here in the U.S., but around the world, with 6 million reported deaths, more than 18 million excess deaths. And those deaths are distributed throughout the regions of the world and not just in North America or in Europe for that matter. Now, we've entered a new phase of the pandemic, a phase where Omicron is much milder and a large fraction of the world's population has been infected with Omicron. The Omicron story is still to play out in China, North Korea. But in general, we're entering this phase where people are going back to pre-COVID levels of interaction. Mask use is really declining dramatically. And I think that's going to be the new normal. And we will see continued Omicron transmission. Omicron will come back in the winter if we don't see a new variant. But it's likely we will see a new variant. And so we will, while we might think that the era of mandates and profound changes in behavior may be behind us, we are certainly haven't seen the end of COVID-19. And so we should be thinking about how we manage COVID-19 new variants as they emerge, and the critical role of continued use of boosters, vaccinating those who are still willing to be vaccinated that haven't been, and the new tools that we have like Paxlovid and potential other antivirals as they come along. All of those combined mean even if we have a new variant, we don't expect it to be as bad as it has been, which is good news. But it should give us pause to recognize the threat that we live with in the future for either some remarkable new variant that will, break through our current tools entirely, or just new pathogens, new pandemics in the future. So hopefully this extraordinary experience in the U.S. will motivate the U.S. government, other governments to invest in greater capabilities to respond to new threats, detect them more early, have a more rational, thoughtful, but rapid response to those threats as they emerge, and then to figure out who are most vulnerable, whether it is the groups that are essential workers or those that have some sort of comorbidity or those that are the elderly, whatever it may be for a new threat. It's critical that we learn about protecting the most vulnerable for future rounds of threats as they emerge. So at this terrible milestone, it is an opportunity for us to reflect both on what went wrong, but how we can solve and prepare ourselves better for future rounds of COVID and future threats.